Hi everyone, my name is Oscar Villeda. I'm a student physical therapist assistant at IoT here in Modesto. And today we're going to be going over thoracic outlet syndrome. Um, and then as throughout the PowerPoint, I'll be referring it as TOS sometimes. And yeah, so let's go ahead and get started. So what is TOS? So TOS, as we have learned throughout the semester and the semester before, right, the thorax consists of 12 vertebrae, right? It's cervical, thoracic, lumbar, sacrum, um, and coccyx, right? So in the thoracic outlet syndrome, it occurs in the thorax portion, right? So as we see here, um, you can see that um, it mainly occurs right there between the clavicle and the first rib, because that is where a lot of like nerves, muscle fibers, and stuff like that kind of run through, right? So TOS occurs when nerves or blood vessels are compressed by the rib, the collarbone, or the neck muscles at the top of the outlet, right? So this little circle there that you can see on this picture here, you can definitely see where it would kind of cause almost like an impingement, almost like, right? So you have the scalenes there, you have the clavicle, you have the artery and the vein, and then the nerves, like the brachial plexus there running through that area, right? So that's a very tight space, right? So yeah, so that's kind of what thoracic outlet syndrome is. So it's basically just a compression-like feeling right here on the like collarbone, clavicle area, right? Um, so now that we know what it is, we'll go ahead and continue on with the causes. So the causes here are kind of not straightforward, I wouldn't say that, but they make a lot of sense, right? So some causes here are trauma to the thorax, right? So if you're in a car accident, right, and it's severe enough where you can cause like a whiplash, right? That really fast movement of coming forward, right, puts your thorax in a very susceptible position of getting those nerves, right, those muscles pinched, right? Because it is also like a very fast um, movement, right? And unexpected too, right? So the muscles there for sure are not expecting that movement, especially in a car accident. Repeated overhead motions, right? So this also kind of refers back to like sports, right? So like football, baseball, swimming, right? A lot of that overhead kind of up the top motion, right? Also um, puts that body part, right? Those puts all of those nerves and muscle fibers, everything there in a very susceptible position of getting like almost compressed or pinched, like, right? Especially because it's a repeated motion, right? Um, so with that being said, right, we talk about sports, we can talk about jobs as well, right? So the example on the slide says mechanics or hairstylists, right? Because they're also kind of in a very not optimal position all day long, right? And they do that work all day, 8 hours a day, sometimes even more probably. So just being in that position definitely aggravates those muscles, and those nerves are there. They're moving around regardless every day. So yeah, and then speaking of stuff that you do every day, poor posture, right? That is another that can be a cause to TOS, right? Poor posture can be from rounded shoulders, right, or even like the forward head syndrome, right? You're in this weird, not weird, but this not what would I say, like optimal position, right? Because you're rounding your shoulders, your head's forward, and then these generations now, right? We're always looking at our phone. We're probably looking at our laptop, really like zoomed in, right? And most of you probably took like a step back and realize you're probably doing that because I know I am. So that position there also just puts those muscles in a very like concentric and very shortened like position, right? And then one thing that I did find interesting as I was researching this is abnormal anatomy. And by what I mean by that is that there are very rare cases where an individual may have a cervical rib. So notice I said cervical rib and not thoracic rib. So we have 12 thoracic ribs, right? But the cervical rib is a rare and unique um, anatomy structure that may occur in someone. And with that being said, another thing that I found that kept popping up was that some individuals may have another, like almost like scalene muscle that runs through here, right? And if there's another muscle there, or if there is like another rib that shouldn't really be there, it also puts that outlet, that space, to be in a very tight position, right? And like I said, a lot of things run through that little outlet there, right? So those are some of the causes that I found that were pretty common throughout the research. So we'll move on to the next slide, which are there different forms of TOS. So when I was first researching this, I didn't think this was even possible, but it kept popping up. So the answer is yes, right? There are different forms of TOS, and we'll list them all, right? So neurogenetic TOS, right, occurs when the nerves leading from the neck to the arm, right, the brachial plexus, is compressed, right, really tight. And as we have learned, the nerves do not like tightness, right? They like to move, they like space, right? So I'll be referring to that as NTOS. And in a lot of these cases that do happen to have some kind of TOS, ends up being NTOS, so nerve-like incident, right? So continuing on, we got venous TOS, right? So venous, right? Throughout the semesters, we've learned that it's a vein, right? So that means that the vein is compressed, right? There might be some kind of clot there or something, and this happens to be about 5% of the cases, right? As in the slide even says, leading to upper body thrombosis, right? So I'll be referring to that as VTOS, and then arterial TOS, which occurs when the arteries are compressed, right? So again, maybe another blood clot or something like that. And that happens to be about 1% of the cases. So it's very rare, like, for this to happen. And then another one is going to be a kind of combination of venous and arterial TOS, and this is known as vascular thoracic outlet syndrome. This was kind of rare when I was looking things up. So I won't be talking about that too much, just because a lot of the symptoms were related to VTOS and ATOS, right? So now that we know that there are different forms of TOS, we'll be continuing forward with the symptoms, right? So symptoms of TOS, right? Just like I mentioned before, there's different versions of TOS. So it depends, right? It depends on if you have NTOS, ATOS, and VTOS, right? So I'll be listing the symptoms right now. We'll start off with NTOS, since that happens to be the most common one, right? If you are experiencing NTOS, it's numbness or tingling in the arms and fingers, pain or aches in the neck, shoulder, arm, or hand, arm fatigue with activity or weakening grip, right? So again, nerves, right? That's what we're thinking. Now moving on to ATOS, again, it's about 1% of the cases. It's very rare, but if you are exhibiting ATOS, it's like a pulsating lump near the collarbone, so you'll have like a throbbing sensation right here around the carotid. Cold fingers, hands, or arms, sorry. Hands and arm pain, a change in color in one or more of the fingers or the entire hand, weak or no pulse in the affected arm, right? Again, blood circulation, right? That's what we're thinking with ATOS, right? And then lastly, VTOS. VTOS is about 5% of the cases that have occurred throughout my research, right? VTOS, you may be feeling a change or seeing a change in color of the hand, or one or more fingers, hand or arm pain and swelling. So as you can kind of see, they kind of relate to one another, right? With like color change, and then pain and swelling, right? The only real difference that I saw with these was with the NTOS. It's a lot of like numbness, tingling sensation, right? So yeah, these are all the symptoms that I was able to come across. And now we're going with the diagnosis of TOS. Again, as you're experiencing these symptoms, right, you're going to make an appointment with your PCP, right, your primary care physician. They're going to go through a physical exam, and in this physical exam, they're going to make you perform certain muscle tests or movements to reproduce the pain, to kind of see what it really is, right? Which category do you fall in if you're having some kind of TOS like symptom, right? And then with that being said, they're going to review your medical history, right? After that, they're going to send you to get an ultrasound, right? X-ray, CT scans, MRIs, arteriography, venography, electromyography, right? These are all different tests that they can do to see and eliminate what kind of TOS you have, right? So treatments. As we go in with treatments, physical therapy, right? It's a big one on NTOS. It's still a form of conservative care, so everyone will be probably referred to some kind of physical therapy. And that's going to be obviously to help and strengthen and stretch the muscles that are really shortened or contracted. Medicines, right? Anti-inflammatory, pain meds, muscle relaxants to kind of help those muscles relax and not be so short, right? Clot dissolving medicine. This is mainly with ATOS and VTOS because again, it's in the arteries or in the veins, right? Such as thrombolytics. And if those are successful, they end up putting you on anticoagulants, just to help with preventing blood clots and stuff like that. Injections, local anesthetic or steroid medicine may be used. And then lastly, surgery, right? So some kind of thoracic outlet decompression, a graft or artificial graft for ATOS. So these are the different forms of treatment that you may be receiving as you continue with your care. So with that being said, I found a study that talked about surgery versus continued conservative care for neurogenetic thoracic outlet syndrome. This study was done to show the benefits of, or to show what would be beneficial for a patient experiencing NTOS. So if they receive surgery versus if they continued getting conservative care like physical therapy, right? And physical therapy could be also injections, medicine, stuff like that. Any kind of form of conservative care. It was a single-centered, non-blinded, randomized controlled trial with 2 parallel groups. At a total of 50 patients, 25 of those patients performed the surgery, 25 continued with conservative care. The outcomes that they used were disability arms, shoulder, and hands, so a quick dash, cervical brachial symptoms, questionnaire, TOS disability scale, quality of life scores, and they were assessed at the beginning, every 3 months, 6 months, and 12 months. So the results of this study concluded that the surgery group had a better improvement in their symptoms compared to the conservative treatment care after 3 months. After 3 months, the people who were getting conservative care also had the option of getting the surgery. Once the conservative group got the surgery, their symptoms improved similarly to the people who originally got the surgery, right? So they were actually like right there. And then ultimately the surgery may be effective for treating TOS when conservative treatments do not work, right? I'm not a big fan of surgery, but if you're trying everything else and you're trying everything to the best of your ability, then maybe surgery can be an option, right? So these are just some results that the study presented itself with. As you guys can see, the blue line is the surgery group and the red line is the conservative care. And the surgery group actually had better scores throughout the entire session. So with everything being said, that is everything that I have on TOS. These are my references that I used. Again, I'm not a big fan of surgery. I rather do the best that I can in physical therapy or any other form of conservative care, just because of my experience with the healthcare system, right, and working with the healthcare system. But ultimately, if you're trying everything and surgery is your last bet, then why not, right? But yeah, so this was all on thoracic outlet syndrome and the different forms of TOS.